This particular case was very interesting, and I am not going to mention her name, but I do have permission to talk about her because it's such a good case. She had sarcoma in her pelvis. Sarcoma is cancer, so she grew a big mass in her pelvis. They had to cut out a big chunk of her pelvis. Since she lost her hip joint, she had no hip joint. They cleaned it all up, took some muscle out too. And so the struggle was, how's she gonna walk? How's she gonna stand? How is she gonna get herself out? The fear of the cancer coming back and all that.
We deliver value-packed content from expert exercises to success stories. Subscribe and follow for real results.
Hi everyone, we're back.
Good morning. What are we going to talk about?
Maybe some uplifting stories that we've encountered in the past. That how physical therapy has impacted their lives.
So we have this one particular patient.
Yes, struggle with her hip. Okay, so this particular case was very interesting, and I am not going to mention her name, but I do have permission to talk about her because it's such a good case. She had sarcoma in her pelvic area, and
What's sarcoma?
Sarcoma is cancer in her bone, and so she grew a big mass in her pelvis, ate up some of her pelvis and her femoral bone. And so what they had to do was to remove it and clean it all up. And in the process, they had to cut out a big chunk of her pelvis, like more than a third of her pelvis, and the femoral head. So
the femoral head is the
hip, the ball part of the hip. So in essence, she lost her hip joint. She had no hip joint. They cleaned it all up, took some muscle out too. So you can just imagine how things are a little hanging there because there's no more attachments. I'm sure the doctor did some, reconstruction in a few areas there, but she's left with no hip joint essentially. And so the struggle was, how's she gonna walk? How's she gonna stand? How is she gonna get herself out? The fear of the cancer coming back and all that was in her way too. She's by herself.
You mean she lives by herself?
She used to, but now she lives with
Okay.
a family member. Yeah. So rehab was hard. I had to really inspire her to think that we are gonna walk again. We did know that the doctor said, at some point she'll be able to weight bear on her non-hip joint, or I'm not even sure what to call it, but
Non-operative.
no, like the one that had no joint anymore. I mean, if you could just imagine, it'll be just soft tissue. We did have permission at some point that we could start putting some weight on it, and we were relying and banking on, we need a lot of scar in there to make things kind of strong and everything. That was our mindset. That's what I tried to instill in her, and we need to work on it, do as best we can with our range, best we can with the rest of her body strength and all that. And not knowing how effective that thigh would be, we just kept on. We tried to improve the knee joint because it's still there, the hip and all that. She had some nerve injury, by the way, too, with the process. So she didn't have any feeling on it. So it was a struggle. She had some pain, and the doctor did well with her pain control, pain management, and luckily she wasn't affected by being drowsy or anything like that. And she was prepared for the discomfort. Her mind. And that's the most important thing, don't you think? That when we're dealing with pain, that we can control how much we could tolerate as far as getting through your day and doing what you need to do. No matter how much pain we have, it seems like our brain is very powerful that way, that we can control it.
Yeah.
Yeah.
And sometimes it's the, your brain becomes sensitized. It's very, very sensitive. It doesn't mean that your patient, she underwent a surgery that removed her hip joint, so there's no bone there and part of her pelvis, right? And her body started to heal, but also at the same time, she's been suffering from pain for quite some time. And it's not just the structure, but sometimes also your brain becomes so sensitized, and things that you do on a regular daily basis, even though they're not really harmful for you, your body will say, I'm hurting. But
Yeah.
is it the body, or is it more like, it's possible that of course your mind plays a big role to it, because we won't hurt without the brain, so that brain has become sensitive. And I think that's what
Yeah, acutely, you'd expect big rawness, like raw pain. As people's pain get chronic and tissues and bones heal up, I think that's when the mind gets powerful and overcome that type of pain, the chronic pain. So I was told and discouraged by some people that you'll never let that person walk. She don't disappoint her. Don't tell her things that you won't be able to accomplish. Don't give her false beliefs and all that. And I don't know. I have turned into a very positive person through my own struggles, physically, mentally, emotionally. That I think we have developed a stronger being. In all aspects. And so I made her believe that we could do it. Well, we started in the bars, she weight bear, shifting and all that. And soon after that, she knew how to kind of like generate enough muscle tone to make it sturdy enough in spite of no joint and no ligaments, to relying on scar tissue. So and you talk about proprioception, joint proprioception, and she didn't have a joint, so a real physical joint. Her physical joint is now comprised of scar tissue. So who would have thought? I haven't even thought about that, but I guess that you could also teach a joint that doesn't even exist with whatever you're left with to feel, to know what it's doing, what position it's in. That's interesting, right? We moved on to walking with a walker, a little bit distance. And that was awesome. We were very happy. I think we cried that day that she started doing that. But guess what she's doing now? She walked with a heavy walker. I'm pushing for her to be able to walk, with one hand free, so she can be able to do things, around the house, carry things and all that, while she's using the other one with a heavy walker. And it's awesome that she's able to do like a household distance now. About 60 feet or even
That's
more, if she has the energy and if she has the mental capacity from day to day. So, and now we're practicing carrying. The other day, she actually practiced carrying a 6-pound weight, or maybe an 8-pound weight, on her other side. And she did it every single time that I give her a challenge, a brand new challenge. It's almost like she tenses up and makes her tired, quicker, and that's where the mind comes. Is your mind makes, if it's nervous and it's not sure what's gonna happen, she stiffens up and tightens up, thinking that she needs to push out more effort. So it's more tiring, but that's okay. That's, I think, self-preservation that's going on. And so, anyway, she made it, our usual distance, and she was very happy once again, very tired, but from where we came from, you know, walking with a walker for 10 steps was tiring, and now she can walk a block with her rolling walker. We have proven, both her and I proved, that with persistence, determination, and mental toughness, and perseverance, and, you know, still doing her exercise, her strengthening exercise, she lifts a lot of weights while she's in therapy, that you can overcome anything. It gets easier as you try and push, and all you gotta do is believe, and that's where she is getting her progress from, is really just pushing through and getting results. Yeah.
Do you think she has she had that, you know, mentality from the very beginning, or was she just learned how to become more positive, and or is that something that she just, you know, slowly, gradually?
No. I as a physical therapist, I think it was one of the toughest things I've ever done. For one, I am in a situation where I've never been before. Never had a patient that I had to train that did not have a joint that's weight bearing, and so I just push through myself too. Like, you know, there are uncertainties, but try to use my common sense, and like, oh, positivity is all too. So I gave her some positive reaffirmations, and let's just, you know, I think it helped, even though she was very fearful of falling in her, damaging her nerve more, damaging muscles. You can just imagine, you know, we're worried about bones first. You know, we're worried about bony spurs that grows in our heels and all that. And here she is, she had a thigh bone that was cut, and it's literally don't you think that looks like a big spur? And so she was afraid. I think between the need of her, of getting better, because for survival, I think we have that in as a human being. It's either we try to survive or we die. So she chose to survive and to live, and so she listened well, and she just needed a person that could reassure and help her through.
So there's such a high value to, you know, giving our patients reassurance, and, you know,
Definitely.
you know, because I mean, we've been physical therapists for, you know, 30 years, and we've seen a lot of tough cases, and, you know, trying to share our experiences in the past to the new patients that are coming in, that, you know, they have all the you know, disabilities and you know, strength to overcome a lot of those struggles that they have, you know, maybe facing right now, maybe physically, you know, mentally, and that kind of stuff. So that's an amazing story. I mean, imagine you don't have your hip, you know, it's and from there you're not able to walk at all. It's not there, and I think you guys did a fantastic job in developing the lubopelvic, you know, area, you know, creating a lot of strength in that region, and more important is that, you know, she has the mindset that goes with it, that we, you know, kind of tap into and say, hey, you know what, we can move through this.
Yeah, nothing is impossible.
Yeah.
You know, I think that's one of the things that I've learned.
Yeah.
It's kind of sad for the other patients that we get now. Since then, I've been way more optimistic than ever. So, you know, finding complicated, complex patients has gotten a little easier. That positivity that got instilled in this process, I mean, has been really reinforced, and so whenever a patient tends to struggle with their mind and their mental toughness, it helps me to go back to this case and say like, hey, you know, with the right amount of balance of pushing and balancing people's feelings and their abilities and their determination and their fears and beliefs and all that. Find a good way to balance all of that. And sometimes it just takes patience and time. Most things takes patience and time.
Don't you think that patience is so important? Like, you know, a lot of us in our culture, things has to be fast, and I want to feel better today. I want to feel, you know, I understand who doesn't, right?
Yeah.
But, you know, yesterday I just had a patient, and she just, you know, doesn't seem to understand that, you know, sometimes it takes time. Those things that you want to have now, as far as I'd like to feel better, you know, now, because I know, I understand it hurts so bad, and there are things that you can do to make you feel better today or the next week. But a lot of those things are short term.
They are
short term. And I have nothing against.
There's always
just
a
like,
letdown after.
Like, you know, if you had an injection to address inflammation or pain.
Especially if it's acute.
Yeah, especially if it's acute. So there's definitely a place for that. You know, therapists giving you modalities and doing this and that maybe it's a massage, or maybe it's a soft tissue. They'll do dry needling. So you have some tools that might make you feel better, you know, today. But you know, we want to address things that might help you in the long term. So we always, you know, incorporate things that what's really going to help you down the road. You know, so I always emphasize to create, you know, a better lifestyle. I know it doesn't sound like sexy because it's a lot of work. You know, it's a lot of work, but you don't have to do. Just be patient and introduce a few little things that might help you improve your outcome down the road. So, you know, little things, you know, doing a few minutes of exercises, to dropping off, okay, I'm not gonna touch it's sugary food, you know, things like that. So start to pick it up, some things that will help you in the long run. So we